Fact or fiction, is type 2 diabetes genetic? There are individuals out there who are at increased risk of developing type 2 diabetes and may not realize it. We are going to look into the question, is type 2 diabetes genetic, and hopefully shed some light on the condition. For those who are unaware, type 2 diabetes is when the pancreas produces too much insulin that the body develops resistance to the insulin and your blood glucose levels are no longer manageable. While every person who is overweight can develop this condition, there are some individuals who are at a greater risk of developing type 2 diabetes than others. If either of your parents have or had diabetes, then you could be at risk of developing the condition. There are certain ethnic groups that have a greater risk of developing type 2 diabetes. These groups include Latinos, African Americans, Asian Pacific Islanders, Native Americans. This list is by no means all-inclusive, but individuals who belong to one, or more than one of these ethnic groups are at an increased risk of developing type 2 diabetes. What increases my risk of developing type 2 diabetes? While we strive to do our best and provide the most comprehensive information, this is by no means a replacement for qualified medical advice. So with that in mind, we need to look at what contributes to type 2 diabetes. The food you eat will play a pivotal role in whether you develop type 2 diabetes or not. We all lead hectic lifestyles and seldom have time to prepare a home-cooked meal. Instead of eating a well-balanced diet, we are stuffing our faces with good-tasting, highly processed foods that are wreaking havoc on our digestive system. These foods are scientifically engineered to taste great but provide the least nutritional benefits, so we are eating nothing but empty calories. These empty calories will be stored as fat on our body and it will make us feel tired and sluggish. Since we feel tired and sluggish, we will not exercise, so the cycle of obesity continues. As we gain weight, our pancreas needs to produce more insulin to control our glucose levels, but since we are consuming these processed foods more and more, our pancreas cannot keep up, and that is when type 2 diabetes starts. Side effects caused by type 2 diabetes. These are just some of the side effects associated with type 2 diabetes which you should take seriously. Over time, as your blood glucose levels remain unchecked, you are going to be at an increased risk of suffering from a nerve damage and reduced vision. These symptoms may not be noticed right away, but it will happen gradually if you are not careful. Fortunately, you can reverse the effects of the type 2 diabetes by getting healthy, and it is really simple to implement by adopting a healthier diet and getting more exercise on a regular basis. Speak with your physician and ask him or her to monitor your blood glucose levels often to make sure your insulin resistance is going back into normal tolerances. By embracing this healthier lifestyle, you are going to look and feel much better, so now is the time to act.